Don't let anything stop you. I know there's a purpose for me to be here. It's probably why he kept me alive. I don't give up easily.
You don't give up easily.
Takes a lot to make me give up.
Hi, Sunshine Nation!
Hey, Sunshine Nation.
This is a very special day.
So I'm running a marathon this weekend.
How far is that?
26 miles, 26.2 miles.
Jackson has been wanting, I'm just gonna cry already just thinking about it. He's been wanting to do it for a very long time. Unbutton your shirt, show him why this is a big deal, what we're gonna talk about today. He has a scar. Tell Sunshine Nation about your heart.
So my heart, it's on the right side and it's flipped over and my veins and arteries are transposed. So my heart, it's not on the actual side that it's supposed to be on.
So most people it's supposed to be over this way. So you put your hand over their heart to pledge allegiance. His heart is actually that way. It's over here. And flipped over like you said.
Yeah. And basically they just cut my chest open because my heart was...
Cracked your rib cage.
Cracked my rib cage?
Yeah.
So they opened me up and...
I used to be able to feel the wire in there, but... Oh, I can still feel it. You feel the wire right here?
Right here.
A little bit of wire right there still. So they wired it shut and then sewed him up, huh? Stitched him up. You feel that? Yeah.
If you know about Jackson, then you know Jackson's a pretty careful person. Now, if you understand how he came into this world, then that might make a lot of sense as to why he's so careful. When Rachel went into labor, we had just watched the Lord of the Rings, and that was the very first film, The Fellowship of the Rings. And because of those, the Nazgul or the ghost riders, those guys scared Rachel. She always would get really tense in the movie when we were watching it. And so by the time that movie was over, she was starting these contractions. And within the next 24 hours is when Jackson was born.
I went into labor and they sent me home, and they tried to send me home, and I said, no, I think we need to be here. We knew that his heart was on the wrong side. It's called dextrocardia, and that alone is fine. We knew that was there, but we didn't know about the extent of it. So I was trying to give birth naturally without any pain meds or anything and just go natural. And the doctors noticed that every time I had a contraction, his heart rate would drop really low. But then after the contraction was over, it would go back up again.
So one of the sisters from church was our nurse. And she told Rachel, hey, if you were my daughter, I would tell you to get an epidural, because Rachel was going all natural. And so because we were doing all natural, she didn't want to do an epidural. But because of the issues that we were having, and because they were saying we probably will have to take him by emergency C-section.
I said, okay, if that's what you would tell your daughter to do, I'll do it. And so I got the epidural, and immediately his heart rate dropped and did not rise again. And yeah, did you know all this? So you're gonna be learning as we tell this story. And everyone started panicking, but thank goodness I had the epidural, but it hadn't come into full effect yet.
They started wheeling Rachel furiously down the halls of the hospital, and he was running and putting in the second epidural at the same time.
I remember they were marking my stomach, and I remember saying, I can feel that. Cut me open and take him out if you need to, but just so you know, I can feel that. And so as they're running along, they're putting more injections in me, trying to make sure I was dead in time.
And then once we got to the operating room, it was amazingly crazy.
The doctor wasn't there. It was only the doctor, and he was in his residency, and he'd only done one other C-section in his life. And it wasn't an emergency situation like this, so he just had to start doing it. It was like the movie ER, or the TV show ER.
Anesthesiologist was yelling at everyone, telling them, get over here, get over there.
But they were yelling in the operating room, get over here, cut her open. And then they said, don't wash your hands, just put on gloves, let's go. And then the anesthesiologist would look at me and say, everything's okay. It's all right. He'd be like, get over here, do this, do that. Oh, it's okay. And I remember just lying there, just praying that the angels would surround them and help them get you out safely. And after they were done and after they took you out, and the cord was wrapped around his neck 4 times. And afterwards, the doctor did finally make it at the very end. The anesthesiologist and the doctors turned to me and they said, we were not alone today. Because there were angels present.
You could feel that was special. There was not a dry eye in the room. People were crying and looking around, and everybody knew that it was a miracle. That was our first experience with childbirth. I was like, wow. And from that point on, I know that any child that comes into this world, it's quite the miracle.
So that was the beginning. That wasn't even his heart surgery. That was just coming out. And so that was pretty intense. And because he had the cord, it was just cutting off his oxygen and everything. So 4 times around his neck. We were in the emergency room every week for the first month. He had all these monitors on his heart. And so anytime during the night when I would hear the monitor go off, that meant his heart rate was dropping, and I would dive across the floor just to like check you and make sure you were still alive. And oh my gosh, it was so much stress nonstop, just making sure he was alive. And then I remember one time your heart rate had dropped to 12 beats per minute. And I had Dad give you a blessing, and I called the ambulance, and I went in the ambulance with you, and it was just going. And they said he had such severe reflux that caused your heart rate to drop. Who has reflux that severe? Then he got pneumonia, and that was making him turn blue. And so finally we went back to the emergency room, and they were going to send us home again. And I said, I'm not going home because I was tired of going in these ambulances. I was tired of like all this emergency was like putting me under so much stress. So I told the doctor, go back and check his heart again. His heart was on the wrong side of his body, and that's all they knew. And that there was a hole in it. And we were praying that that hole would close up. And they said, he's fine. It's just on the wrong side and there's a hole. And so I said, you go back and check his heart again. They said, we've already done echocardiogram. It's sufficient. And I said, go back and check it again. I was a little feisty. And the surgeon came back. He sat by my side and he said, in my 20 years and thousands of hearts, I have never seen a heart like this. And guess what? That was the moment I stopped crying, because it was like, okay, now we can move forward. Now we know what the problem is, and now we can know what to do. So he was so cute. He'd crawl around with this big, long oxygen tube. I'll crawl around the house and super active. But before his surgery, your oxygen levels were at 68%. You're supposed to be in the 90s. His lips were just blue all the time, and just getting weaker and weaker. And Abe was singing in a music group, and he was going on tour. And my mom had cancer. And so she had just gone through surgery and was going through her chemo and radiation treatments. And it was just a lot. He had his surgery, and the very next day after your surgery, Dad had to leave for it was a whole month. Maybe it was 2 weeks. I just held you every day, just held you and helped you get better. The surgeon, when he finished, he said, to tell you the truth, I can't even explain the complexities of his heart to other medical doctors. It's so complex. He said, I can't even tell you what his future will hold. He said, because some kids, whenever they're on the wrong side, they need a pacemaker, but because it's flipped over, he won't need a pacemaker. They said, isn't that amazing?
Yeah.
Yeah. They said, some kids, the holes that we were praying would close, once they went in there, they realized the holes were saving his life because it was releasing the pressure. His blood was all mixing, the red blood and the blue blood, which means the oxygenated blood and the non-oxygenated blood. The holes are actually saving your life. What a miracle, huh? Sometimes when prayers aren't answered the way we think they should be, it's because God says, but I see the whole picture. All we saw were the holes, but God was seeing the whole picture. He said, no, actually this little problem of the hole is saving his life. Awesome, huh? But the surgeon, I remember I would see him everywhere and I would just go hug him and I said, thank you for saving my son's life. Thank you. And after a while he started walking the other way because I kept like hugging him so much. I think he was like, enough of the hugs. But can you imagine a mother just so grateful that her son's life is saved and that he had the skills and the ability to do that. Pretty amazing, huh? Makes me so emotional, but I'm so grateful. What a miracle. You are, but it was so much every day, just crying and wondering what was going to happen. After his surgery, he had tubes coming out here and here. They had all the medications in him that they could possibly give him to sedate him so he wouldn't move. So they didn't have the railings up on the bed, on your crib, because they're like, that kid isn't moving. He just had major open heart surgery. Oh, he rolled over on his stomach, got up on all fours, and almost crawled off the crib. In the ICU. In the ICU. The nurse told us, she was like, yeah, sprinted across the room when she saw you crawling. Like hours after his surgery, trying to crawl off the bed. Are you kidding me? You scared, because can you imagine if you had fallen off that crib? That would have killed you, yeah. Because all these things were pulling out of him, and it was just such a tender surgery stuff. They had to create patches and tunnels. We have pictures of the surgery of his heart. They took pictures of it because they'd never seen a heart like it.
So basically, my heart on the right side, the doctor always told me I was gonna be like this small kid. I'd be really short and wouldn't be able to do many activities. But now seeing I'm about to run a marathon, that's really motivating me, because it's just basically proving that no matter, nothing can hold you back from what you want to do. You can, if you want to fulfill your dreams, don't let anything stop you. You can always find a way to do it.
Absolutely, absolutely.
And it's crazy, because I feel fine with everything I do. I'm just very blessed, very grateful.
I think that all the trauma that he endured as a baby made his nature of who he is so much more sensitive. You're more of a sensitive soul, I think, because of it. Mm-hmm. He takes time to listen. I sometimes say, come on, Jackson, hurry up. But he's the one that stops and listens and takes time. And I appreciate that. Whenever you were little, he had a hard time communicating. And I think it was from the trauma of the surgery. We moved to Michigan. They hadn't seen him yet, and they hadn't even read his report yet. And I was in the bathroom, the radiologist doing the echocardiogram came and talked to Jackson before I came back, and he was just talking to him for a while, and then he came up to me, the guy who did the radiology, and he said, your son is so well spoken. He is so nice to talk to. And I just smiled, because I knew that he had struggled so much communicating, and I didn't say anything like that was his struggle, but I just smiled. And then we went on, and then he started doing the echocardiogram and checking him, and then he started reading the reports on him, and he just stopped everything, and he looked over at me and he said, man, this paperwork says that he had severe language delays and that he couldn't communicate with people. And he's like, but that's exactly what I was just complimenting him on. And I know that God made that weakness turn into a strength because of the power of prayer. I strongly believe that God gives us weaknesses so that we can turn to Him and pray to Him, and that He can turn those weaknesses into strengths.
Proud of you, Jackson. Just want to say good luck on your first marathon. I know you'll do a great job, and I couldn't be more happy that you're actually going out there and doing this after all the things the way that you started your life, all the things that you've overcome. And I just want to say I'm very, very, very proud and very, very pleased and happy to be your dad. Congratulations.
I don't give up easily.
You don't give up easily.
It takes a lot to make me give up.
And good luck to you, Rachel. I love you.
I'm just glad to be able to run, that God has blessed me with all this ability. And I know that I didn't recover just naturally. I know that God helped me. And I know there's a purpose for me to be here. Probably why He kept me alive.
I know when we were in the waiting room and waiting for hours and hours during the surgery, there my mom was sleeping on a couch because she was exhausted from cancer. My son was getting operated on, and I should have just been devastated. But that was a moment that I'm grateful for, because I've never felt God's arms wrap around me so fully as that moment. I remember sitting there going, I'm actually okay. And the only I just felt it. I just felt these arms from God just saying everything's going to be okay. And in my mind, I wasn't panicked of were you going to die or not. In my mind, I knew that whatever was supposed to happen was going to happen. I'm grateful that his plan was that you're alive and that you have this purpose. So we wanted to just take a moment, our whole family, and express our sorrow for the shooting here in Florida. Just the sadness and the lack of love of how that happened. And we are just praying for the families that are affected, and we are just so sorry. And we are grateful because there's this amazing story. Oh, it's an amazing story. She said, "Dear friends and family, I have to thank my Lord and Savior for sparing my daughter's life today. I feel blessed beyond words knowing that many didn't survive. I wanted to give an update since there has been an outpouring of love and prayers on her behalf, and I as her mother have truly felt them. She made it through her second surgery. She incurred multiple gunshot wounds with an AR-15 assault rifle. The surgeons didn't know how many exactly, but she's alive, which is a miracle. As the surgeons said, it only takes one. She had one that went through her back, crushing her ribs, piercing through her right lung and exiting through her stomach. Several went through her shoulder and traveled the length of her right arm before exiting. She lost so much blood, but she is stable and in the ICU. She will undergo a third surgery to put in permanent titanium plates to hold her ribs together. Even after all of that, the bullets missed her liver, reproduction organs, heart. She could have been paralyzed. It is a miracle. We ask you to please keep praying for all the families who are affected by this. Those families of the survivors who saw and endured so much trauma, and those who have lost their loved ones. And we too will be joining you in that prayer. We do believe in miracles, and we do believe that God has a purpose for us. God bless you all. Keep loving people. Keep loving each other.
Thank you guys so much. Thank you for all your support and all the love that you show. And I just want to encourage you all to love. Always give love.
Spread sunshine.
Yeah, spread sunshine.